So hello lovely dear students, कैसे हैं आप लोग? Exam is now over. So first of all, I welcome to all of you guys on this recall session of the physiology, the exam which held yesterday on the 6th of the July, and I wish that you all may pass. So the few things which I would like to let you first of all, that's this is all the MCQs which we are going to be discussed in this session. This all are basis on the recall which actually the student told, and how the students are telling and what they are saying, that's it's only basis on this. So if you find any correction in any questions, you can just verify me, you can just let me know, and accordingly I will just modify those questions, right guys? तो मेरे हिसाब से शायद बेटा कल सभी बच्चों का द फर्स्ट पेपर, it was the moderate paper as the student said, and I hope that that first paper was done perfect by most of the students. And second paper, as the student told me, that there was some tricky questions. Basically the language is different, so might be they just made you just little bit confused with the language. But overall I can say that on the 6th of July the paper was moderate. It was not very easy, it was not very hard, so I would go with the moderate part as the student told me. ओके अभिषेक, राम राम बेटा, राम राम। पेपर देके मजा आ गया फिजियो से, तो वेल डन गाइस, वेल डन बेटा। So I hope beta that physio helped you a lot to solve this paper, and not only about the physio. Once you studied the physio, you just not able to solve the physio MCQs. Even you can solve the other subjects MCQ as well, because physio is the basic part of the human body, and that starts to integrated with all the many subjects about the clinical subjects and lots on, right? So let's start without wasting so much of time this recall session. So first question which asked on this recall basis, the student told me the question was on the GFR. So which condition will decrease the GFR? So they basically just asked about the decrease the GFR, and as the student told me that the option was there was the efferent arterial constriction, afferent arterial constriction. The option C was the increased Bowman capsule hydrostatic pressure, and option D was decreased glomerular hydrostatic pressure. So kindly verify me whether all of these options were there. Okay, Umar, physio was easy. Thank you, Gulam. Thank you. Okay, so according to this question, the answer of this question was, this is the decreased GFR will be due to the afferent arterial constriction. It is due to the afferent arterial constriction, right? So this is due to the afferent arterial constriction, and in the class we also discussed that the many part, that's this GFR basically depends upon what? It depends upon the glomerular hydrostatic pressure, then the blood colloid osmotic pressure, then capsular hydrostatic pressure. So three pressure were there, and also we discussed in the class that how the GFR is actually changes, and I told you that this afferent arterial constriction, remember beta, this afferent arterial constriction, this actually decrease the renal plasma flow, so that GFR is going to be decrease. So this is direct question from our physio workbook. Yes, okay, afferent और efferent में से एक option था, no problem. Okay, first tell me whether they ask about the decreased GFR or they ask about the increased GFR. Yes guys, please tell me first of all what they ask. They ask about the decreased GFR or they ask about the increased GFR. Islam saying, sir, it was increased GFR. Please, anybody who can clarify me whether it is increased or decreased GFR. Okay, so if you guys says, then exactly this question we discuss in that 25 most important as well. Okay, so it was not decrease, it was increase GFR, right? So if it was the increase GFR, if it was the increase GFR, then what about the option? If it is increased GFR, then afferent arterial constriction is not the right answer. Then the efferent arterial constriction, it can be. Then remaining three options. Please tell me, what about efferent arterial constriction था क्या option में? Yes, guys. Afferent arterial constriction में था. Afferent arterial constriction में था. Yes, students. ओके सो एक होगा देन फिर efferent arterial constriction. दूसरा ऑप्शन होगा आई थिंक सो द अनदर ऑप्शन वाज दैट efferent arterial dilation. Efferent arterial dilation. Okay, one option was increased plasma flow. Increased plasma flow. Okay. Increased plasma flow. ओके एफरेंट नहीं था, एफरेंट काट दिया बेटा अपन ने, एफरेंट को हटा दिया है, राइट सो इस एफरेंट को मैंने काट दिया है. सो वन ओके ड्यू टू efferent arterial resistance. Okay, so option were efferent arterial resistance. Okay, so this was the language, efferent arterial resistance. So efferent arterial resistance, efferent arterial dilation, increase plasma flow, increase plasma flow. ग्लोमेरुलर था क्या ऑप्शन के अंदर, या कैप्सुलर? हाइड्रोस्टेटिक प्रेशर का मेरे को बताया था बच्चों ने सर कि देयर वाज सम हाइड्रोस्टेटिक प्रेशर रिलेटेड वाज क्वेश्चन वाज देयर. So please clarify me whether there was a hydrostatic pressure was mentioned in the option. Okay, hydrostatic pressure increase was there, and this hydrostatic pressure they mentioned capsular or the glomerular? Which one they mentioned, capsular or the glomerular? Okay, so increase, so remove this one, this is increase so basically it is increase glomerular hydrostatic pressure, right beta? So now we got it, three options. This is not the option. So A, B, and this is C, and this one is the D. So this was the question, right question. This is how it actually the frame, how the student told me. So this, which condition will increase the GFR? Afferent arterial resistance, efferent arterial dilation, then the increased glomerular hydrostatic pressure and increased plasma flow, right beta? So I think this was afferent arterial resistance, efferent arterial dilation, increased Bowman capsular hydrostatic pressure, increased glomerular plasma flow. Baldeep, you are saying sir afferent arterial resistance, efferent arterial dilation, increased Bowman capsular hydrostatic pressure and increased glomerular plasma flow. Beta, if you are saying that one, then the answer should be increased Bowman capsular hydrostatic pressure. But if this was the option out of these options, because you know that GFR mechanism completely, I told you that this is your Bowman capsule, and this is your afferent arteriole, this is your efferent arteriole. So if basically if we will constrict this area, the GFR will be increase. If we will constrict this area, the GFR will be decrease. And also if the hydrostatic pressure area if increase, so this will resist to come more blood over here, more urine over here, so it will also decrease the GFR. So accordingly you can get the right answer. According to, if that question was there and if there was these similar option were there, then the right answer of this question is that efferent arterial resistance. Then the right answer of this question was efferent arterial resistance, right beta? Okay. Plasma flow was not in the option. Okay, fine. Let's move, will not take the more time. Let's move to the second option, second question. कैपिलरी से था कुछ आदित्य हैं. Okay, okay beta, fine. No problem. Whatever there was the option, we just discuss about it. Because GFR, this basically depends upon the language of this question. They always give this question GFR coefficient option bhi tha. Okay. Okay, fine. Let's move on the second question. And the second question says that which ion channel were defect in CFTR gene mutation. So student told me, sir, this CFTR gene mutation, basically they did not mention this cystic fibrosis. They mentioned the CFTR gene mutation, right, beta? They mentioned cystic fibrosis in the question or they mentioned CFTR gene mutation? Please answer me. Yes, guys. They mentioned cystic fibrosis in the question or CFTR gene in the question? So if you are remember, what was in the option? Options are same. Yeah, chloride, sodium, potassium, calcium. Yes. Okay. So CFTR gene mutation was there. Okay, fine. So you know this is bread and butter question. We discussed many times in the class, and even I told you during the studying of the respiratory system. And beta, this time I would like to say that from the one page, from this one page, remember beta, ये workbook की page, इस एक page से आपके दो question आए, right? So this one page you got the two questions. Number one, which we discussed, this is the CFTR gene. This CFTR gene, and I also told that this is cystic fibrosis transmembranous regulator, which defect in the chloride channel. And here is we do the sweat chloride test. And also we mentioned beta, हमने यहाँ पे बोला था, it is very very important. अगर वो पूछेगा CFTR, तो वो या तो चैनल पूछेगा और या वो टेस्ट पूछेगा. And this time examiner asks the channel, right beta? CFTR gene, this is 100% chloride channel, right beta? Okay. Now, one more questions came that we are going to be discussed later on the downside. And from this same page, in the second paper, student told me, sir, वहां पे पूछा था the inner lining of the trachea, it is which epithelium derived? So, inner lining of trachea is derived from which epithelium? This was the question. So, this was the question again from the same page and just about 2-3 lines. And this was the answer. This was the answer, guys. Pseudo-stratified ciliated columnar glandular epithelium, right? So this question was also there in the exam. I hope so, right? Okay, fine. So answer of question number 2 is chloride. Okay, this is chloride. Now move to the third question. This is the tracheal inner layer deprived by which epithelial lining? Yes, beta. वेरी गुड. सो वंडरफुल गाइस. आई होप कि ये क्वेश्चन किसी का भी गलत नहीं हुआ होगा. द सूडो स्ट्रेटिफाइड सीलेटेड कोलुमिनर ग्लैंडुलर एपिथेलियम, PSCCGE, that we discussed in the class with the cilia. What is the function of cilia? Everything we discussed in the class, right? So remember beta, this page, this single page, how beautifully from this single page we just got the two direct questions, right beta? Wonderful. Right? Okay. So this is pseudo-stratified columnar epithelium, and I hope that this answer is right for each and everyone. Right, beta? Very good. Very good. Okay. Yes. Yes, Nitin, we are coming. Peripheral chemoreceptor question के ऊपर आ रहे हैं बेटा अपन. Now, so again in the talking about this trachea, we also made this table, and again in this table we mentioned that this trachea, this is having which epithelial type beta? PSCCGE, pseudo-stratified ciliated columnar glandular epithelium, right? Now Now, this was the question this time, the ABG disorder. The ABG disorder, right, Buddha? The ABG disorder. And this time, with the ABG disorder, the examiner didn't give you the value. He just asked you directly the image of the ABG analysis, which is actually the printing paper that you got it into your exam, right, Buddha? So this was the question. The question same tha, beta. इसी तरीके से it was the frame. What is the ABG disorder in the given image? This was the question, बेटा. कुछ इसी तरीके से फ्रेम था ये. और ऑप्शंस के अंदर there were no any compensation, no any compensatory, partially, fully. They directly gave you this respiratory acidosis, alkalosis, and the metabolic acidosis, alkalosis. Right? You got it same. And also, the student told me about the value. So value basically you got this pH, you got it 7.182. Then CO2, this was 22.23. This was the value. Okay. Okay, so this was the value. This is the value has been given. 7.18 was the pH and CO2 was 22. And students were saying me, sir, no bicarbonate were given. But beta, bicarbonate is actually given. And where was the bicarbonate in this report? This bicarbonate is actually on the downside. But as you never seen this ABG report, so I hope that you didn't focus that where is the bicarbonate. Actually, you were seeing with this with this value the bicarbonate value, but as you can see, this is the gas values only. Okay, so here is the gas, then the electrolyte, and then your calculated values are there. So that is how basically, if you just यदि आपने ये चीजें पढ़ी होगी बेटा, then you can easily find it out that's किस एरिया में बाइकार्बोनेट आएगा, किस एरिया में गैसेज आएंगे, राइट? ओके, तो स्टूडेंट ने मेरे को कहा कि सर O2 was low, so O2 is also mentioned is low, 72. Right, beta? So as we discussed in the class many times that this pH is basically depend either on CO2 or either on the bicarbonate. So this pH is in acidic side. This pH is in acidic side. So this is your acidic side. This is your acidic side. And low CO2 is always causes the alkaline. So this CO2 is not the culprit. This CO2 is not the culprit. Then who is the culprit? We have to look for the bicarbonate, and this bicarbonate value over here, it is actually giving something else. So this is like, you can say this is the 18. This is the 18. So this 18 bicarbonate, actually this is, I zoomed it so much. So this is looking something like 2, but it is 18.4. So this 18.4, actually this is the cause of this less bicarbonate. It goes towards to the acidic side. So you can see, guys, this is causes the acidic, and what is happening to the pH? pH is also going towards the acid. So this is your metabolic acidosis, right, beta? So right answer of this question was metabolic acidosis. Okay, the metabolic acidosis. So this question, pretty straightforward question. Okay, PCO2 value is wrong. Okay, no problem. No problem, but we are not focusing on the oxygen level. We are focusing either on the CO2 or on the bicarbonate. So even if you can't see the bicarbonate, अगर आपने बेटा bicarbonate भी नहीं देखी होगी ना वहां पे, तो you know कि CO2 अगर कम हो रहा है, तो CO2 कम हो रहा है, ये तो alkaline करवाएगा ना. CO2 अगर कम हो गया, acid part is less, तो ये तो alkaline करवाएगा. And pH is going towards the acidic. So CO2 is not the cause. Who is the cause? Then the next, that is the bicarbonate. It's pretty straightforward question. So this is metabolic acidosis, right, beta? So I hope you marked it correctly. In the class we discussed, these are the values that we have been discussed, that this CO2, this is acidic in nature, bicarbonate is alkaline in nature, and these are the values, normal value. pH less than 7.35 is acidosis, more than 7.45 is alkalosis, right, beta? Okay. No, beta, if these are the values, if CO2 was given less, how it could be the respiratory acidosis? How it could be the respiratory acidosis? Respiratory acidosis के लिए तो basically आपकी जो value है बेटा, इस value को 22 से ज्यादा होना पड़ेगा, यानी कि this PCO2, it must be more than 45. then only it will be the respiratory acidosis. Okay. अच्छा, PCO2 was value was given 55. बेटा प्लीज करेक्ट मी, PCO2 35 से कम था और PCO2 45 से ज्यादा था? प्लीज क्लैरिफाई गाइस. राइट. ओके, मेरे को ये बताओ, PCO2 22 था. भरत, you are saying sir 7.1 and PCO2 is 22. Okay, so PCO2 was 22. Many students are saying like that. So most of the students saying sir PCO2 is less. Beta, if it is less, Ganesh, if it is pH decreased and PCO2 increased and bicarbonate normal, then it is respiratory acidosis. Yes, but what I got. Okay, so 22 ही था PCO2, then final, if the CO2 is 22, then it is metabolic acidosis, nowhere it is respiratory acidosis. Okay beta, so this is acidosis, that for sure, but this is, if CO2 value is 22, then it is metabolic acidosis, that's pretty sure. Okay, fine. Now let's move to the next question. What is the function of secondary messenger? And beta, this secondary messenger, okay, so what is the function of secondary messenger? That we have been, I think this MCQ discussed in biochem as well, and we studied about this secondary messenger, that what is the secondary messenger. So basically I got only the few options related to the answer, or the options basically. So next two options or the more two options I didn't get it from the students. सो सेकेंडरी मैसेंजर के अंदर अपन ने बेटा बात करी थी क्लास के अंदर पे कि दिस वाज द सेकेंडरी मैसेंजर, हाउ दे बेसिकली एक्ट वाया दिस डायग्राम. वी जस्ट got about the mechanism, what is the secondary messenger. So from here, this gives the message to the nucleus, who is the commanding center of the cell. So these are the main hormones, they are the primary messenger, and from the cell membrane, who is giving the signal up to the nucleus, they are the secondary messenger that we discussed, right beta? Okay, mediate the intracellular hormone response. Okay, and these are the secondary messenger which we have been discussed in the class, that CMP, CGMP, IP3, DAG, calcium, and the most common receptor over there is the GPCR. So everything we discussed, right beta? Now please tell me about the options of this question. Yes, they act on extracellular membrane receptor only. Asif saying sir mediate intracellular hormone response. Intracellular hormone response. Intracellular hormone response. Okay, yes, secondary messenger function, we know that it transmit impulse from the intracellular to the nuclear membrane, right? Only was not mentioned. Okay, very good guys. So secondary messenger function, you know it, and what was their proper options were there. So accordingly, I hope that everybody marked it correctly, right? Now coming to the ECG, and this time the ECG beta, ECG which we learned in the class, right? Which we learned in the class about the ECG, that MI ECG and all the leads, सारी leads अपन ने बेटा याद करी थी. This one, V1, V2, V3, V4, V5, V6, septal, anterior, and your lateral, and downside is 2-3 AVF, 2-3 AVF, right beta? So this was the question, that what is the finding in given ECG. And on options, there was the anterior wall MI, inferior wall MI, lateral wall MI, and the septal wall MI. This was the question. Now, please tell me, where, in which lead you have seen the changes? In which lead you have seen the changes from the student? I just clarified that in the exam, this particular image was given for the ECG. तो यही इमेज थी बेटा. प्लीज टेल मी, दिस वाज द इमेज. सबसे पहले फटाफट से बताओ बेटा, क्या यही इमेज थी? यस. अच्छा, पोस्टीरियर वॉल वाज आल्सो इन द ऑप्शन. कौन सा ऑप्शन में नहीं था बेटा? एंटीरियर, इंफीरियर, लेटरल, क्या ये तीनों थे? क्या ये तीनों थे बेटा? एंटीरियर, इंफीरियर, लेटरल. कमलकांत. Okay, so this was the same ECG, right? Perfect. Okay, septal was not in the option. So instead of septal, there was posterior wall MI. Posterior wall MI. Okay. Posterior wall MI and image was same, right, beta? Okay, image was same. So now if image was same, then you can see the changes into this picture. The changes is occurring into this V3, you can see, V4, you can see. They are clearly, they are mentioning that there are the changes is actually, yes, septal nahi tha. Okay, fine. Then it is pretty sure. It is pretty straightforward question. You can see the V3 and V4 changes are there. And V3, V4 beta, V3, V4. Yes, guys, V3, V4. Which wall am I? Which wall am I? This is which wall am I? Yes. Perfect, beta, perfect. ये wall of MI we can never forget. कभी भी नहीं भूल सकते हैं बेटा. We can always remember that in which wall am I, which changes will be occurs, right? Okay, so right answer of this question was anterior wall MI. This is typically the anterior wall MI, right? Everybody is right. Very good. In the class, we also discussed the same, all the wall MI. These are that. Now coming to the next question. Now please tell me, there was a question related to the maximum water reabsorptions, right, beta? Maximum water reabsorption. And in this maximum water reabsorption, please clarify me that some students were saying me, sir, in the last option was there that's renal tubules reabsorb maximum water in presence of ADH. Beta, ADH mention tha kya question mein? The question was basically it started with the clinical history. Some chronic alcohol person की कोई हिस्ट्री थी जो कि कोई भी इस क्वेश्चन से उसका रिलेशन नहीं था. लास्ट लाइन उन्होंने पूछी थी दैट विच पार्ट ऑफ रीनल ट्यूब्यूल्स रीअब्सॉर्ब मैक्सिमम वाटर. ये क्वेश्चन कुछ इसी तरीके से फ्रेम था बेटा. इनिशियली दे जस्ट गिवन यू द हिस्ट्री, द क्रोनिक अल्कोहलिक पर्सन हिस्ट्री, एंड इन द लास्ट they just asked that which part of renal tubule reabsorb maximum water. Okay, so even if it was the ADH, which part of renal tubules reabsorb maximum water in presence of ADH? Even if this was the question, student told me, sir, proximal convoluted tubule नहीं था, proximal tubule था सिर्फ, convoluted उन्होंने उड़ा दिया था. Proximal tubule and distal tubule. This is loop of Henle. This is loop of Henle and the collecting duct. Yes. Okay. So not the serum aldosterone. His serum ADH, his ADH level is high. Okay. So this is how the question is actually framed. Okay, let me make the changes. A chronic alcoholic person comes with the history of abdominal pain, dehydration, weakness, and lethargic condition. His ADH level is high. Which part of renal tubule reabsorb maximum water? Okay, so option में था proximal part of collecting duct. Proximal part of collecting duct. Yes. सो इवन सो बेटा कुछ भी इस ऑप्शन के अंदर वो दे दे, कुछ भी, चाहे वो एडीएस दे दे, एल्डोस्टेरोन दे दे, कुछ भी दे दे, अपन ने बात करी थी चाहे चांद को सूरज कह दो, सूरज को चांद कह दो, बट स्टिल द मैक्सिमम रीअब्जॉर्प्शन विल बी हैपन at the proximal tubules, at proximal tubule PCT. This is we discussed in the class, right बेटा, this we discussed in the class, और मैंने आपको यही बताया था कि वो चाहे कुछ भी दे दे, कुछ भी पूछ ले, कोई भी सिनेरियो दे दे, मैक्सिमम रीअब्जॉर्प्शन इट इज ऑलवेज इन द पीसीटी. All through, it is not asking that where actually the ADH is functions. It is just asking that where is maximum reabsorption of water is happens. Even if ADH is present still in the collecting duct, because out of 100% water, the 70% water will be reabsorbed in the PCT, and in the collecting duct around only 15 or 12% water will be reabsorbed. In presence of ADH or in absence of ADH, there will be even less. So out of this, if we can see that 12% is more or 70% is more, definitely the 70% is more. So right answer of this question was the proximal tubule, right beta? Right, Kamalkant, very good Kamalkant, right? Yes, Ganesh. Okay, so कुछ भी क्वेश्चन में होएगा, आंसर proximal tubule ही रहेगा, there will be no any changes. So right answer is proximal tubule, right? That we also same discussed in the class. Now ओके, कमलकांत बस एक ऑप्शन देखा. अच्छा, बहुत सारे बच्चों ने इस क्वेश्चन के लिए मेरे को ये रिकॉल दिया, सर हमने कुछ नहीं देखा, बस रीअब्जॉर्प्शन मैक्सिमम पूछा था. उसने जैसे रीअब्जॉर्प्शन मैक्सिमम पूछा, आपने कहा हुआ था सर पीसीटी, सर पीसीटी ही हमने ढूंढा और प्रॉक्सिमल टिब्यूल देखते ही हमने आंसर लगा दिया, बाकी ऑप्शन हमारे को ध्यान ही नहीं है, राइट बेटा? सो यू डिड इट राइटली. दिस राइट आंसर ऑफ दिस क्वेश्चन इज प्रॉक्सिमल टिब्यूल. ओके, नाउ myasthenia gravis from the neuromuscular junction. This one single image which we discussed in the class, and I told that in Lambert-Eaton syndrome, morning worst, evening better, and in myasthenia gravis, the morning better and evening is worst. And in myasthenia gravis, this is the postsynaptic condition. And this question is given something like this, that a man comes to the hospital with presence of ptosis. On history, he feels irritated and condition getting worse as the day progress. While doing outdoor activity, what could be the most probable cause? बेटा क्या ये क्वेश्चन ऐसा ही था? ओके सुनीता. अच्छा, एज द डे वर्सेज नहीं था बेटा? Condition getting worse as the day progress. Please first of all clarify me whether this question is framed something like this. कुछ हिस्ट्री दी हुई थी पर्सन की और पूछा था कि there was some ptosis. This is clearly mentioned, this was the ptosis, and he also feels irritated. Okay, chewing something like. Okay, अच्छा दो क्वेश्चन थे related with this, two question were there. ओके, सेम हिस्ट्री थी सर. ओके, हैंड वीकनेस. बेटा इस क्वेश्चन में जो क्लू था वो क्लू बेसिकली होएगा ओनली एंड ओनली कंडीशन, व्हाट कंडीशन हैपनिंग एज द डे प्रोग्रेस. it will getting better or it is getting worst? Ptosis irritate chewing but not progress with the day. सो क्वेश्चन के अंदर बताया होगा कि क्या कंडीशन है. टोसिस, यस, दिस इज द वन क्लू. दिस इज ऑल्सो द क्लू. अच्छा, ड्रॉपिंग ऑफ आईलिड था. ओके फाइन. सो ड्रॉपिंग ऑफ आईलिड, ये लो बेटा, ड्रॉपिंग ऑफ आईलिड. Nitin, you are saying, sir, getting worse as the day, that only you was looked for. अच्छा, नो बेटर नो वर्स था. अच्छा, एक क्वेश्चन माइस्थेनिया ग्रेविस के टेस्ट पे भी आया था. ओके, डिफिकल्ट इन ओपनिंग माउथ. ऑप्शन में दोनों थे, लैम्बर्ट-इटन और माइस्थेनिया ग्रेविस. पहले ये बताओ, ऑप्शन में दोनों थे, लैम्बर्ट-इटन एंड माइस्थेनिया ग्रेविस. गुलाम, इंक्रीज व्हेन डे प्रोग्रेस. व्हाट इंक्रीज? अच्छा, दो क्वेश्चंस को बच्चे एक्चुअली में मिक्स कर पा रहे हैं, थॉर्नपिक हिस्ट्री और समथिंग. Okay, so both options were there, Lambert-Eaton and the Myasthenia gravis, and from the Myasthenia gravis, as the student is saying, that two questions were there, sir. So I think might be बेटा कल एग्जाम हुआ है, 300 क्वेश्चन दिमाग में है, और बेटा I understand that's it mixing up, no problem. ओके फाइन. तो अगर उन्होंने ये दिया था बेटा ड्रूपिंग ऑफ आईलिड एंड डिफिकल्टी इन च्यूइंग एंड ऑल्सो द वर्स एज द डे प्रोग्रेस व्हाइल डूइंग, सो अगर ये कुछ इस तरीके का था, देन द आंसर ऑफ दिस क्वेश्चन वाज माइस्थेनिया ग्रेविस. ओके, अच्छा, थॉर्नपिक वाला टिटनस से था. फाइन. यस यस आभा, it happens students are getting confused. दो क्वेश्चंस एक ही सेम टॉपिक से आ गए, पढ़ावा उन्होंने इतना अच्छे से था, और उसी के अंदर स्टूडेंट्स कंफ्यूज हो रहे हैं. डेफिनेटली आई अंडरस्टैंड इट. सो बेसिकली अगर कुछ इस तरीके का था, ड्रूपिंग ऑफ आईलिड एंड ऑल ऑफ दिस कंडीशन, दैट्स दिस इज गोज टुवर्ड्स द माइस्थेनिया ग्रेविस. ओके गाइस, ओके फाइन. नाउ नेक्स्ट, मूव टू द नेक्स्ट क्वेश्चन. यस, द पर्सन comes to the emergency room with the RTA history having thoracic and abdominal injury found with the hypovolemic shock. What could be the most probable reason in decreased cardiac output in this person? Yes, beta. Now coming on the question number 9th. Coming on question number 9th, a person comes to the emergency room with RTA history having thoracic and abdominal injury, means he is having massive bleeding. And already it is mentioned in the questions that hypovolemic shock, ये mention था बेटा, ये mention था. क्या ये mention था बेटा इसके अंदर? hypovolemic shock mention था. Yes. बेटा लैम्बर्ट भरत, लैम्बर्ट-इटन के अंदर पे मॉर्निंग उसकी जो है वो बेसिकली बहुत पुअर रहेगी. मॉर्निंग के अंदर वो कुछ भी नहीं कर पाएगा. बट इवनिंग के अंदर जैसे जैसे द डे विल बी प्रोग्रेस, इवनिंग के अंदर जाते हुए पर्सन को थोड़ा सा बेटर फील होने लगेगा, बिकॉज इन द लैम्बर्ट सिंड्रोम देयर इज अ प्रॉब्लम इन द कैल्शियम चैनल ऑन द प्रीसिनेप्टिक एरिया. So when the action potential was coming and calcium was moving inside, this fast calcium channel is actually get defected, mutated, so that this calcium will not able to enter into the presynaptic area, so that neurotransmitter will not able to release. And if it will not release, what will be happen? This person wants to do immediate activity, this person cannot do this. So this is for the Lambertitan. But in myasthenia gravis, the problem at the postsynaptic area, where it is the postsynaptic receptor for the acetylcholine, basically they are destroyed. So similar thing happens even after coming the calcium, the exocytosis will be happen, neurotransmitter will come outside, but there is no receptor is present, so nowhere it is going to be bind, and again this postsynaptic membrane cannot go into the depolarization, right? So this was the history of this. Now इसके अंदर पे क्या था बेटा? Decrease contractility of the heart. Okay, due to decrease contractility of heart. Okay, this was the option. Cardiac muscle contraction. Okay. Decrease preload, increase preload. Yes. Decrease contractility of heart. Same thing. Something of stroke volume. अच्छा, समथिंग ऑफ स्ट्रोक वॉल्यूम. अच्छा, वहां पे कुछ बच्चों ने मेरे को बताया सर ऑप्शन बी जैसा जो लिखा हुआ है डिक्रीज आफ्टर लोड, उसकी जगह लिखा हुआ था डिक्रीज पोस्ट लोड. ओके, इंक्रीज प्रीलोड. यस, डिक्रीज प्रीलोड आ गया बेटा, इंक्रीज प्रीलोड आ गया, डिक्रीज कॉन्ट्रैक्टिलिटी ऑफ हार्ट and something of stroke volume. Okay, Asif, something on stroke volume. So instead of this, something of stroke volume. Okay, something on stroke volume. So even we know that's in hypovolemic shock. The person is in hypovolemic shock. We know that if less blood will reach into the heart will also send it out the less. So cardiac output will be less. So this is pretty straightforward question. अगर कम ब्लड हार्ट में आएगा तो बेटा आगे भी तो कम ही निकलेगा. हार्ट की मसल से इससे कोई लेना देना नहीं है, क्योंकि अंदर ब्लीडिंग हो रखी है, तो आपका जितना भी जो ब्लड है जो वेसल्स के अंदर था वो सारा लीक आउट होकर बाहर आ गया है. सो लेस वेनस रिटर्न, decrease venous return will lead to decrease cardiac output, and this is due to क्योंकि जो भी ब्लड हार्ट के पास आ रहा है that is actually going into the which area? Into the left ventricle, and this left ventricle when it is fully dilated, how much amount of blood is coming into this left ventricle, that we call as EDV, and diastolic volume beta. Remember, and diastolic volume, and this end diastolic volume is also known as the preload. This is also called as preload. So इस लेफ्ट वेंट्रिकल में कम ब्लड आएगा तो कम ही तो बाहर जाएगा. That's the reason of decreased cardiac output in hypovolemic shock. Right answer of this question is decreased preload. Right, beta? Okay. Okay, fine. So decrease preload, and that we also discuss in the class that in hypovolemic shock, there will be less blood coming to the heart. That's the reason of the less cardiac output, right, beta? So this is hypovolemic shock. The most common cause is hemorrhage, decreased cardiac output due to decreased venous return, right, beta? Okay. Coming question number next. ए पर्सन हैविंग लोअर लंग इन्फेक्शन फील्स हाइपोक्सिया. जो अभी किसी एक बच्चे ने बताया था बेटा कि हाइपोक्सिया के ऊपर कोई चैनल के बारे में पूछा था, पेरिफेरल कीमो रिसेप्टर की बात. पर्सन हैविंग लोअर लंग इन्फेक्शन feels hypoxia which lead to decreased oxygen concentration in blood. Which ion channel mechanism will detect the low oxygen in the blood? कुछ क्वेश्चन इसी तरीके से फ्रेम था. बच्चों ने मेरे को बताया सर 2-2.5 लाइन का ये क्वेश्चन था. It is 2-3 lines, 2.5 lines, something that bigger question this was. Yes, beta. Yes, Bhuvana, it is right answer. If question is same, something question is asked. क्वेश्चन के अंदर दिया था बेटा कि डिक्रीज देयर इज द लंग इन्फेक्शन, लोअर लंग इन्फेक्शन इज देयर. ये था मेंशन, लोअर लंग इन्फेक्शन मेंशन था, जिसके कारण वो ये बता रहा था कि अंदर ऑक्सीजन नहीं जा रही है. अच्छा, इट वाज डायरेक्ट क्वेश्चन. Okay. Okay, Anurag, it is same like that, right, beta? So we discussed, yes, sir, it is peripheral chemoreceptor. अरे वाह, अब की बार तो फिजियो ने आपको बहुत मजा दिया होगा बेटा इस पेपर के अंदर पे, बहुत मजा आया होगा आपको, कुछ कॉन्फिडेंस भी आने लगा होगा कि यस सर वी कैन डू इट. यस यस यस. अच्छा, they just asked directly the peripheral chemoreceptor has which oxygen sensitive channel? Okay, no infection was given there. Fine. No infection theory was given. Okay. Right answer of this question is potassium. Beta, potassium. This was the glomus cell. Remember in the class we discussed. This is the chemically control. It is the chemoreceptor, peripheral chemoreceptor. This is oxygen sensitive, hypoxia sensitive. Those channels are hypoxia sensitive. And you know that these are the glomus cell which detects the oxygen in the peripheral chemoreceptor. And I also told you that this is potassium sensitive ATPase channel, potassium sensitive ATPase channel. Okay, right? So this is the glomus cell question from the peripheral chemoreceptor, and the right answer of this question is potassium. Right answer of this question is potassium. Okay. वेरी गुड, वेरी गुड, छोटा डॉक्टर. क्या टिपिकल नेम है बेटा आप लोगों के, जो आप लोग यहाँ पे मेंशन करते हो अपने, छोटा डॉक्टर, राइट? वेरी गुड, वेरी गुड, वेरी गुड. कमिंग टू द नेक्स्ट क्वेश्चन, दैट which protein which protein binds with the calcium in smooth muscle? Straightforward, in smooth muscle we discussed about that this is the calmodulin. This is the calmodulin. So direct question, this is in the smooth muscle. When the smooth muscle there is actually the endoplasmic reticulum was absent, so no inside calcium was present. So now this calcium comes from the outside, and when it comes outside it must bind with what? This calcium must be bind with this calmodulin protein. So this calmodulin protein, right, Buddha? So this is the smooth muscle chapter. We discussed about it. Which protein binds with the calcium in the smooth muscle? This is with the calmodulin, right, Buddha? Calmodulin. Okay, Bhuana. 4 ions related question. Very good. ओके, काल्मोडोलिन, ट्रोपोनिन, ट्रोपोमाइसिन ये थे. मेरे को बच्चों ने बताया सर कि सारे ऑप्शन सी से ही थे, सारे ऑप्शन सी से स्टार्ट हो रहे थे. तो मैं कहूं कुछ भी स्टार्ट होए, चाहे वो ट्रोपोमाइसिन, ट्रोपोनिन कुछ भी हो, द कैल्शियम इट बाइंड्स विद द काल्मोडोलिन इन द स्मूथ मसल, दैट इज श्योर, राइट बेटा? नाउ द नेक्स्ट क्वेश्चन इज, कोई टोटल बॉडी वाटर से क्वेश्चन था क्या? प्लीज टेल मी, इन द 60 kg मेल व्हाट इज द अप्रोक्सीमेट टोटल वॉल्यूम ऑफ एक्स्ट्रा सेलुलर फ्लूइड? कुछ ऐसा क्वेश्चन था क्या? फर्स्ट टेल मी, because from this various student this recall I got it. Few student told me yes sir total body water से एक क्वेश्चन था, और उसने एक पर्सन का वेट दिया हुआ था और पूछा था कि टोटल एक्स्ट्रा सेलुलर फ्लूइड कितना होगा. अच्छा नहीं था, दिस क्वेश्चन वाज नॉट देयर. ओके फाइन, ठीक है, अगर ये नहीं था ओके जस्ट लीव इट. ओके, बिकॉज फ्यू स्टूडेंट टोल्ड मी. Okay, fine. Move to the next question. Which of the following primary lymphoid organ? And this question you also discuss in the another subjects as well. And right answer of this question is that is the thymus. Also, it is the bone marrow, right? Bone marrow. So thymus and bone marrow. एक्शन पोटेंशियल का क्वेश्चन, एक्शन पोटेंशियल का क्या क्वेश्चन था बेटा? वो कुछ ऐसा सा क्वेश्चन था क्या कि द लोकल एनेस्थीसिया इज गिवन टू द पर्सन ऑन द हैंड, एंड नाउ आफ्टर व्हेन दिस मसल इज पैरालाइज्ड, now which channel will help to regain the functionality of this muscle? Something this type of the question was there. Because Kamal, with cystic fibrosis we already discussed, that is CFTR gene. Okay, So first tell me, कुछ ऐसा ऐसा क्वेश्चन था, that's in the question they asked that local anesthesia is given, local anesthesia is given, paralyzed muscle will regain its activity via using which channel? Via using which channel? And in the option sodium was given. Sodium was given. सोडियम दे रखा था सर. थैंक यू बेटा, थैंक यू. Okay. So when regain its activity or when the muscle starts the action potential, which channel will be open? And you know, through this graph we discussed that is how this is the threshold value and where this action potential is actually starts. So which ion will move inside over here? This is the sodium. So sodium is actually okay. ओके सो बेटा कुछ भी हो, उसने कुछ भी फ्रेमिंग बना के दी होगी, यू नो दैट फॉर द एक्शन पोटेंशियल सोडियम चैनल इज रिक्वायर्ड, नीड टू बी ओपन, राइट? So right answer of this question, if this is something given, the channel is asked, then this is the sodium. Sodium was the right answer, right beta? Sodium influx. Okay. Now from the type of fibers, ये question कुछ था ऐसा सा that according to the Erlanger-Gazer classification, which is the example of type C fiber? कुछ ऐसा सा इस बेटा, इसकी मेरे को complete language नहीं मिल पाई इस question की. If you can help, anybody can help me whether this question was there or not. कुछ प्री गैंग्लियोनिक मोटर नर्व, पोस्ट गैंग्लियोनिक मोटर नर्व फाइबर, कुछ ऐसा सा ऑप्शन में दिया हुआ था. अच्छा, एर्लिंगर गेजर का सी फाइबर से कोई क्वेश्चन नहीं था. ओके फाइन, ओके गॉट इट गाइस, गॉट इट. नहीं था, बट एक्शन पोटेंशियल का वो सोडियम चैनल का वो था, राइट बेटा? थैंक यू सुधांशु, फिजियो के क्वेश्चन सॉल्व करने में मजा आया. डेफिनेटली बेटा, इफ यू नो इट, इट रियली हेल्प्स यू अ लॉट. अच्छा, एक जीआईटी से कोई क्वेश्चन आया था. जीआईटी से जो क्वेश्चन था उसके अंदर क्वेश्चन आई बेसिकली डिडंट गॉट इट, बट जो अपन ने ये टेबल पढ़ी थी, बच्चों ने बताया सर इस टेबल में से जीआईटी हार्मोन की इस टेबल के अंदर से गैस्ट्रिन, सिक्रेटिन, सीसी के, इसका कुछ क्वेश्चन था. ऑप्शन के अंदर सीसी के, गैस्ट्रिन, सिक्रेटिन, जीआईपी कुछ दिया हुआ था. ये कुछ क्वेश्चन था क्या बेटा? ये कुछ क्वेश्चन आया था क्या एग्जाम के अंदर? प्लीज क्लैरिफाई मी. ये नहीं था ना बेटा? क्योंकि मैंने भी बच्चों से कहा कि अगर ये होता तो डेफिनेटली आप मेरे को बोलते हैं. सो दिस वाज नॉट द क्वेश्चन. ओके, दिस वाज नॉट द क्वेश्चन, राइट? सो आई डिडंट गॉट बेसिकली दिस क्वेश्चन. एक कुछ जेवीपी से रिलेटेड एमसीक्यू आया था, वो भी मेरे को नहीं मिल पाया था. उसमें ऑप्शन में कुस्मोल ब्रीदिंग था जो अपन ने पढ़ा था. कुस्मोल ब्रीदिंग, उसके अंदर कुछ था, कार्डिक टेम्पोनाट की कुछ हिस्ट्री वगैरह दे रखी थी. दिस वाज सम क्वेश्चन वाज देयर. आई डिडंट गेट द प्रॉपर क्वेश्चन. ओके, कुछ मसल स्पिंडल और गोल्जी टेंडन ऑर्गन से रिलेटेड कुछ क्वेश्चन पूछा बताया था. Yes, Novik, oxygen sensitive channel we already discussed. That is the potassium channel. That is the peripheral chemoreceptor. Earlier we already discussed this question. Okay. कुछ जेवीपी से रिलेटेड कुछ था, उसके अलावा एक कुछ मसल स्पिंडर और गोल्जी टेंडन ऑर्गन से रिलेटेड कुछ था. क्वेश्चन नंबर 17, मेरे को क्वेश्चन नंबर 17 के लिए प्लीज बताओ। ओके, सो मसल स्ट्रेच रिसेप्टर से कुछ आया था। 17 क्वेश्चन वाज देयर। So I didn't get the proper recall of this question. What was the question? Student told me, sir, कुछ क्वेश्चन में दे रखा था कि बेसिकली द मेंटेन द पोस्चरल टोन ऑफ द मसल एंड इट नेवर अलाउ टू ओवर स्ट्रेच ऑफ द मसल। बट आई डिडंट गेट द प्रॉपर। ये क्वेश्चन क्या सेम इसी तरीके से पूछा था? प्लीज प्लीज क्लैरिफाई। What is the reason for muscle spindle decrease length during when the muscle is contract? So Vida, if you find these questions later on, you can just message me and I will give you the answer properly. Because if I didn't get any proper answer of this question or proper framing of this question, then we could not go with the proper answer, right? So who remember this question, you can text me later on the WhatsApp. Now some question was on there that the transporter channel of the iron, कुछ ऐसा सा क्वेश्चन आया था जिसमें कुछ हेप्सिडीन ऑप्शन के अंदर दिया हुआ था. This was the question. ओके आसिफ, क्वेश्चन था मसल लेंथ इज डिक्रीज व्हाइल द मसल इज कॉन्ट्रैक्टिंग. अगर ये था कि हाउ द मसल लेंथ इज डिक्रीज व्हाइल द मसल इज कॉन्ट्रैक्टिंग, देन द आंसर इज गोल्जी टेंडन ऑर्गन. ओके, क्योंकि अच्छा सॉरी, लेंथ को चेक कर रहा है, मसल लेंथ देन द मसल स्पिंडल. अगर मसल की टोन के लिए बोल रहा है, अगर यस, ओके सो ओके, लेट्स फर्स्ट ऑफ ऑल, जब आपको अगर ये क्वेश्चन मिल जाए तो बेटा यू जस्ट टेक्स्ट मी. Okay, so mix basically the recall I am getting for this question. कुछ ऐसा सा क्वेश्चन था कुछ आयरन का? नहीं था. ओके, अच्छा, which protein is decrease? This question is asked basically. Okay, fine. So let's cut this question as well. And some question that we already mixed up with the troponin tropomyosin, that is I think that question with that smooth muscle related. Okay, that is this question we already discussed, right beta? So overall we can see that few questions that we got in the wrong in this recall, that is that not asked in your exam. So if I would say that if from the physiology you got this enough questions in your exam beta. So most of the question that's we have discussed, you just rectified me, yes sir, they just asked in the same framing, and most of the questions now you got the answer as well. अब आप लोगों को सबको पता भी चल गए होंगे बेटा. So I hope कि आपका ये पेपर बेटा बहुत अच्छा गया होगा. अब ये ऑलरेडी पेपर सबमिट हो चुका है बेटा, ये पेपर अब सबमिट हो चुका है. सो दिस इज द टाइम, नो नीड टू बी वरी अबाउट एनीथिंग कि सर मेरा पेपर ऐसा हुआ या ऐसा हुआ. नाउ पिछले कई महीनों से बेटा आप बहुत दिन रात की लड़ाई में लगे हुए थे और आप अपने घर वालों से बहुत दूर थे. दिस इज द टाइम टू रिलैक्स विद योर पेरेंट्स, विद योर फैमिली, एंड जस्ट गिव टाइम ऑल्सो टू योर लव्ड वंस. क्योंकि बेटा अभी ये जो रिजल्ट से पहले का टाइम है, ये बिल्कुल आपको एंजॉय करने का टाइम है. जो कुछ होना था सब हो चुका है, सब कुछ अच्छा होगा क्योंकि आपने दिल से मेहनत करी है बेटा. और जो दिल से मेहनत करता है, गॉड इज ऑलवेज विद दैट गाय, राइट? सो रिमेंबर, गॉड इज ऑलवेज विद द हार्ड वर्कर पर्सन, एंड दैट इज व्हाई you are going to be passed for this exam. I am sure, if you are not sure, but we all missed family, we are sure that you can come with your flying colors on the day of result, right beta? So this is how you always will be rock in your life. Always just be positive बेटा. जो हमेशा हम लोग कहते हैं, चाहे कुछ भी हो, चाहे कितनी भी मुश्किलें आए, कितनी भी कठिनाइयां आए, हमने को हमेशा बेटा पॉजिटिव रहना है और हमेशा मुश्किलों से लड़ना है. और जिस खूबसूरती से आप पिछले कई महीनों से इस मुश्किलों में लड़े हैं बेटा, we know it, we definitely know it, and we salute you. We all Mist family salute you for your all dedications and for your hard work. And definitely beta, we all Mist family, we wish, pray to God that you all may pass. Right beta? तो अब अपन पास होके जा रहे हैं. And now already that's different faculties are already lined up. So I'm not taking so much of time right now, because right now the next recall session will be start. Right. बेटा आसिफ, कोई टेंशन नहीं लेनी है. बस कमल, डोंट वरी डियर, डोंट वरी, गॉड ब्लेस यू. तो आप सब लोग बस पास होंगे, चिंता मत करिए बेटा. जस्ट फिंगर इज क्रॉस्ड, प्रे टू द गॉड एंड लिव हैप्पीली विद योर फैमिली. राइट बेटा, दिस इज द टाइम. सो थैंक यू वेरी मच once again, and may you all pass. Thank you.